Hello, guys, and welcome to episode 1, Focal Aware Seizures. So, in this episode, we'll be going over some background information, some causes, symptoms, and like what to do when you see someone experiencing these seizures, and like how to avoid these seizures through medications, like what are some medications and everything like that. We will be going through in this episode. So, let's kick things off. So, basically, imagine your brain is like Times Square. So now lights are flashing, people are moving, everything is buzzing in harmony, basically, right? Now, a focal aware seizure is like one random billboard just suddenly glitches out, and it plays like a really weird video, and so everybody's just standing like they're just standing at this billboard, going like, "What's happening?" So now that is basically what's going on. A small part of your brain fires off abnormal electrical signals, and it's called focal because it starts in one specific area, and aware because you're just basically fully conscious the entire time when you experience these seizures. And there's no blackout, there's no collapsing. It's like your brain is just throwing like a mini party in one corner without telling the rest of the brain. And a fun fact of would be like these seizures, focal aware seizures, they used to be called simple partial seizures, but doctors updated the name because there's nothing really simple about these seizures. They're just a little more complicated than that. Now, why do these seizures happen? The short answer is because your brain can be kind of dramatic, and the longer answer is just that there's lots of possible causes. So some people can develop them after a head injury, a stroke, an infection like meningitis, and it's caused by an infection, most commonly viral or bacterial. Others might have a brain tumor or scar tissue that messes with normal brain signals, and for many, it's linked to epilepsy. And epilepsy is just where the brain is more prone to these electrical hiccups. But here's the kicker: triggers. Triggers are like a big thing to talk about here. So now these don't cause the condition, but they can really pull like the fire alarm. So here's some common ones. So there's sleep deprivation, so just pulling out all nighters and everything that can make your brain just freak out and everything like that. You have stress, alcohol, flashing lights, or even skipping medication. Now just picture your brain as like a teenager. If it's tired, stressed, or if it's like overstimulated, you gotta expect some attitude from it at least. That's just how teenagers are. And then on the top left corner, you can see like a list of medications and everything. There's a ton of them. Those are the most. Those were those used to be like past medications. These are not updated now. Some of them I believe are used still today, like the bottom ones over there. And yeah, pretty much it for causes. Now for symptoms. Symptoms. Now basically, focal aware seizures can look wildly different depending on which brain lobe decides to go rogue. So now there's many. Now just there's four brain lobes, and brain lobes are like a certain area of your brain. Now the parts that are connected to seizures would be the focal, would be sorry, not the focal, frontal and the temporal. Those two brain lobes are directly linked to seizures. So now you have certain areas of these lobes that basically can cause these seizures to, so not cause, but like that can like really cause these symptoms, like cause your twitching of the hand, arm, face, cause some deja vu, like all these different types of symptoms that you might experience during these seizures. For example, motor cortex, that is a section of the brain that can cause twitching in one hand, jerking your face, and sensory areas would be like tingling, numbness, or even feeling like your skin is like buzzing. The occipital lobe would be you'd be experiencing some weird visual distortions, like everything just looks sideways or pixelated. The temporal lobe, as I just mentioned before, that's like the deja vu capital of the world. You might feel like you've lived through this exact moment before, or suddenly get like a powerful sense of fear, joy, or nostalgia. Like it's going to be coming out of the blue right there. And then you have the olfactory and the gustatory areas. You'll just like just phantom smells or tastes. 1 second you're fine, and the next second you can just swear you feel some like random smoke or taste metal, when in reality there's just completely nothing there. And symptoms, these seizures, they only last under 2 minutes, but for the person experiencing it, it just feels totally different. Like their reality just flipped into another channel for a moment. Like you're just like in another universe like this. in your own world. And people just often remembers everything like afterward, which can be both reassuring and very unnerving. Now we have avoidance and answer. So how would we kind of just avoid these seizures? How do you stop these seizures from happening? Now, to answer how to like stop these seizures from happening, it's really like not possible to stop these seizures from happening like 100%. These seizures will happen no matter what. But I guess you can like try to like lessen the frequency of these by taking your medication, anti-seizure medication, things like carbamazepine or some other medications that you're on. But lifestyle matters a lot too. So sleep, that's like a big buzzer beater right there. You better get your sleep. Without sleep, you might not. Your seizures will just like continuously happen. You have to prioritize sleep, manage stress. Do not skip your meds. Meds are it's like super obvious. Meds, it's in its name. Like these things are meant to like lower the frequency. If you do not take your meds, it will obviously just increase the frequency. And you got to keep track of what's like going to trigger you and everything. It's basically just adulting, but for your neurons in your brain. Now, what you have to do to if you now what do you do if you see someone having one? Now, one thing you get to do is just stay calm and reassuring. Just make sure you do not just panic and everything. They're still conscious. They do not need you waving your hand in front of them or on their face and like just yelling like, "Are you okay?" Like they're clearly having a seizure. They just cannot respond to you. They're like going through something right here. Asking them, "Are you okay?" is not gonna help at all. So now, calm reassurance works best right here. Okay, make sure they're safe. Like if they're holding a knife or something, or some like something that might just appear not super safe, like a pencil, a knife, something like that. Make sure you take that away. Put that in the side. Do not grab them. Do not restrain them. Just let the seizure play out. Let the seizure do its thing. Your brain will just autocorrect basically. And if you can, jot down what you notice. How long it lasted. What movements you saw. Did they seem scared? Scared? This is just perfect for the doctor. This is on the app itself. Just you know, write it down on the app, the notes section, and this will just help your doctor see like what is happening, when it's happening. Just a seizure app. This right here. This would help. Taking notes down. This is just perfect for your doctor. This is gold for your doctor. And remember, these seizures might look strange, but to the person like to the person that's experiencing it, it's like super exhausting. It's super confusing, and it's sometimes it's like definitely embarrassing. The best thing you can do is just treat them with the same respect you'd want if your brain decided to throw like a 2 minute glitch party. Just treat them the same, treat them normally, and yeah, that's all I have for today for focal aware seizures. Just use the app that is linked to this video right here. Uh, just use the app. Take notes of what's like happening, as I just said before. Use an app. Make sure you give the app like give the app notes. Like you sorry, use the app's notes section. Give it to the doctor. You know this is perfect for the doctor. Anyways, this is the end of episode 1, focal aware seizures. Thank you and have a nice day.